Hi you guys, my name's Anel. This is my first YouTube video. So I wanted to share with you guys my thyroid cancer story. Sorry about the noise, I'm sitting outside and it's very windy and a lot of cars passing by, but the lighting was pretty good out here today. It's very sunny. So, you're either watching this video because you were possibly diagnosed with thyroid cancer, or maybe you've already gone through thyroid cancer procedures, or maybe you know someone who has thyroid cancer, possibly a friend, family, or a loved one, so you want to know more about thyroid cancer. Well, here is my story. So I'm going to talk to you guys about how I found out I had thyroid cancer and a little bit about how my procedure went. So last year, September 2017, I went in for a physical and there was a doctor on call. So it wasn't my normal typical doctor that was used to seeing me. It was a lady working weekends. She worked once every other Saturday. As soon as she walked in, she looked at my neck before anything. I hadn't got weighed in or, didn't even check my heart rate. She just noticed my neck and was like, "You have a goiter." She just told me straight up, "You have a goiter." And a goiter is in your large thyroid glands. And I was like, "What? No, I don't. I just have a fat neck." She's like, "No, you have a goiter." And she starts palpitating my thyroid, and she's like, "It's very enlarged." I was like, "I've always had a fat neck, this is just the way it is." And she, starts touching it more and more. And she said she was very concerned that I looked like my thyroid was very enlarged. So before she did anything, she sent me out to get an ultrasound of my neck for 2 days later. My appointment was. So my physical went fine, left my happy little butt out of there. So 2 days later, I go and get my ultrasound, and the ultrasound technician couldn't tell me much because she's not a doctor, so she couldn't diagnose me. But she was able to tell me that she noticed some abnormal mass on my neck, and that was that. About 1 or 2 days later, I received a call from Stanford. That's the hospital closest to me that accepts my insurance. It's in San Jose area, which is about a 2-hour drive for me. And they're calling me so I could schedule a biopsy because they said they noticed a lot of mass on my neck, which was what the ultrasound technician had told me. So I made an appointment at Stanford, and I went. It was about 2 days later, and they took what's called a fine needle aspiration biopsy. So they grab this tiny little needle and find the spots that they want to biopsy, which for me was 4 different spots. It was both top sides here and both bottom sides right here. And they grab the little needle and they find the mass that they want to biopsy, and they literally jam it and just tuck, 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 they're jamming it. So they're scraping off skin cells, and they put them under the microscope and to see if it looks cancerous, and if it does, then they take it in lab and all whatnot. When it is cancerous, the results come back very fast, or at least they call you back very fast, because by the next day and a half, 2 days, I received a call and they told me that it was cancerous. So from then on, I scheduled an appointment with a doctor in the ENT department, ears, nose, throat department, which specialize in thyroid cancer. And my doctor, I love her, she's amazing. And pretty much she told me that my cancer was pretty much spread out all over, all the sides. All 4 points that they took, they all came out positive. So she said it because of my age. I am 26 years old, which was, I was 25 at the time. I'm considered low risk, but it's still very dangerous because of where it was touching. It could easily spread to other nodules and whatnot. So they scheduled surgery about 2 weeks from that date that I seen her. And let me tell you about my surgery. So surgery wasn't too bad. There was not much for pre-op. I didn't really have to prepare for it. Day of surgery, I went to my appointment. They knocked me out. Anesthesia kicks in real quick. My surgery lasted about 7 hours. I know when I woke up for my surgery, I had my parents and my boyfriend there waiting for me. I had to spend 1 night at the hospital because it's protocol, which they wanted me to spend 2 nights because my calcium levels are very low, because your thyroid is very close to your parathyroid glands, which are help for your calcium levels and and I don't know if they kind of touched it or something, but my calcium levels were very low, but they allowed me to go home with just some calcium supplementation. I was able to eat that same day. Some people are scared they won't be able to eat, but no, because your thyroid has nothing to do with your esophagus or anything that goes down your throat, so you're able to eat just fine. I mean, I gobbled down some Chipotle with chips and salsa and whatnot. So my healing time was about a week to 2 weeks recovery, so I could be able to start lifting things. It doesn't really hurt. You just feel a little pressure, like getting up and out of bed feels kind of weird. I felt I had to get up like a mummy, you know. I was like crossing my shoulders and I feel like I had to put support on my neck. So that was kind of the weird situation there. But other than that, it wasn't too bad. My scar, if you can see, it didn't heal too nicely. So I will be having surgery again because I currently have cancer still. They found out that I have more on this side. Just recently I had another biopsy done in February, and I will be having surgery in 2 weeks. So my doctor, which is the same doctor I had previously, she said she learned a new technique on how to conceal the scar, so she's going to try to get rid of that. So when I found out I had thyroid cancer, I was not upset or devastated. Not until I was talking to my surgeon about, possibly removing my thyroid. That is what devastated me. Because, I mean, living life with no thyroid and having to take hormone replacement for the rest of your life is a little scary. So, I mean, I did what everyone does. I Googled, I watched every YouTube video out there. I think I watched a video of Muscle Madi, and that kind of kept me going. But not this. The surgery is not what scared me. That's not the scary part. It's this part that, having no thyroid, and they say, oh, you're going to have fine brittle nails, your hair is going to fall out. My doctor told me it was going to be harder for me to lose weight since my metabolism was going to slow down, because thyroid plays a very important role in your body for people that don't know that. That's why I think it's in the center of your body. I don't know, but that's what devastated me. I mean, my boyfriend, poor guy, I credit him so many times, and he heard. But I want you guys to know that it's okay. You will be fine. Believe me, I'm great. I feel great. Actually I have lost weight since my surgery, and I can make another video about that, how I'm taking care of myself now. So if you have any questions, please let me know. Like, comment, subscribe. Thank you.